follow and be a fan of Holtorf Medical Group on Facebook. That's how we do a lot of our promo stuff. And, you know, I think there's still occasional people out there who don't want to be involved with Facebook, but, you know, pretty soon it's pretty much going to be a requirement. But in any case, we do a lot of promo through that. So I want to remind everyone for that. And our discussion tonight, as you may have seen, was promoted as Boobs and Bioidenticals. And I've just renamed it just ever so slightly, with all due respect to our wonderful web guy, Mike. And I appreciate everyone's assistance, Jenny and Mike and Dr. Holtorf. And Dr. Holtorf will be joining us in a little bit, so he'll be helping us out through the question and answers. However, I have some, I think, very interesting information to share with you this evening. And what we're looking at really is how balanced hormones reduce your risk of cancer. And this has been extremely well documented at this point. So generally speaking, hormone therapy is not a treatment for cancer. There are a couple of exceptions. But what we're really interested in, definitely my own work prior to and also now with Dr. Holtorf, and he's been doing this a very, very long time, is in the area of really helping people feel their best. We take care of hormone imbalance and low thyroid and fatigue. Those are kind of the main areas that we deal with, but we also deal with all sorts of other illnesses that conventional medicine just frankly doesn't do a very good job of helping people with. We're delighted to get to do the work that we do. My own background is in OBGYN. However, I do not deliver babies anymore. I don't do gyne anymore. I had already narrowed my practice to menopause and hormone balancing and weight loss. And then I began learning about helping men with hormone balance as well. And so I was fortunate enough to be able to work for Dr. Holtorf at the Foster City location, which is near San Francisco. And so we're all rooting for the Giants right now, for those of you following that. So let's get started. This is the first book that I have written, and more books will be forthcoming. I will be working on that, so I'm going to get that working with Dr. Holtorf, including the material that we're going to cover this evening. So this is my first book, which is a small, short book to really help people get started dealing with perimenopause types of things. But really, again, my focus has been on hormone balancing for a very long time. Now, I think it's likely that everybody on this call realizes that the medical healthcare arena, which is up on the left-hand corner, the left upper area of this little symbol, is the area that we're dwelling in tonight. However, it's clearly not the only area that people need to pay attention to, especially in the areas that we're talking about with cancer prevention, optimal health. No question that nutrition and diet are extremely important to that. The mind, body, spirit of aspect of things, that's worth a whole interesting webinar. Perhaps we'll do that at some point. And then, of course, physical fitness is also extremely important. So as I said, just because we're focusing on the medical and healthcare arena doesn't mean that it's the be-all, end-all, for sure. So a lot of areas of the body are hormonally active. These are not all of them. I'm just going to summarize the upper three areas as the brain. The brain has hormonally, extremely influential in the hormonal activity of the body, especially governing the glands that we see going down from here. So thyroid is to a great extent controlled by the brain. then the adrenal glands as well, the ovaries in women, testicles in men. So these are just some of the hormonally active tissues. Also, I want to note that excess weight is hormonally active and can disrupt hormone balance when people are carrying excess weight. So we titled this, the subtitle of this talk was Going Beyond the Pink Ribbon. And we love the pink ribbon. We're in the month of October, Breast Cancer Awareness Month. And the pink ribbon is a symbol of all of the work being done to find a cure for breast cancer in particular. And really, I'm pleased to give this presentation tonight because if we could focus more on prevention, that would be pretty remarkable and would certainly save a lot of suffering. So let's talk a little bit about the immune system overall. So the immune system basically has two sides to it. One side is the cellular side. This is how I'm going to describe it. The cellular side is where there are immune cells, various types of white blood cells. They attack what they perceive as foreign invaders that could harm the body, and they form that, let's say, cell-to-cell combat part of the immune system. The other side of the immune system is the humoral or hormonal side of the immune system, and that's really where our focus is tonight. And so the first step when people are not feeling their best, very typically we will find hormone deficiencies, and this can only be found by looking at a very detailed array of laboratory tests and also interpreting those tests in a particular way. So a lot of times our patients are told that everything is quote-unquote normal, whereas in fact their levels are barely inside excuse me, of a reference range. And so that would be a hormone deficiency that we would want to correct. Then the next step beyond getting people up to, let's say, adequate levels of various hormones is optimizing. And another way of referring to this is people use the phrase optimal health or ultra health. And so that's kind of the next phase of really getting people optimally healthy, optimally able to have highly functioning immune systems and avoid getting sick. So another way of looking at the immune system is that we are born with certain features. We are born with the glands that make the cells to do the cellular side. And there's also the acquired arm of the immune system, where we develop antibodies as we are exposed to things. And that's the hallmark of a normally functioning immune system. So first of all, we've got I'm just jumping in now to talk about various hormones, and we're going to go through quite a few different ones tonight. First of all, we have estrogen. Estrogen is the primary hormone for women in terms of feminine characteristics. And the production begins mostly at puberty, and it actually stimulates immunity. It lowers our susceptibility to infection. It actually increases the production of certain white blood cells, certain types of white blood cells that secrete antibodies into the blood. In some parts of the body, estrogen has a direct effect on tissues. For example, on vaginal and bladder tissue, there is an improved resistance to the normal bacteria in that area of the body. And a very common thing after menopause when women have lower estrogen levels is an increased incidence of bladder infections. This is just one small example. There are also some animal studies. This is showing a mention of studies in chickens that estrogen directly fights certain viral infections. Progesterone is the other balancing hormone for estrogen, and progesterone is considered protective against cancer in general. We'll talk more about that, specifically relating to women and breast cancer, in a little bit. So progesterone modulates or influences the proper function of white blood cells. During pregnancy, it actually assists in the development of the baby's immune system. And as we mentioned, it balances estrogen. So there are some cancers, for example, some forms of estrogen can actually stimulate certain, for example, the lining of the uterus in women, and this is balanced by progesterone. So in a woman who is having monthly menstrual cycles, this happens every month. The estrogen stimulates the lining development, the progesterone stabilizes that growth, and then the withdrawal of estrogen causes the menstrual cycle. So it's very important, even with a bioidentical hormone regimen, to have estrogen and progesterone balanced. Testosterone is important in men and women. Of course, it's extremely important in men. It's the primary hormone for masculine characteristics and men feeling their best. However, at the immune level, it has these various impacts as well. It protects tissue against the attack of various infectious agents. It stimulates immune function. It actually protects the thyroid gland. This happens in men and women. There's a lot of interaction between all of the hormones, and this is one particular aspect of it. There are many studies that show lower incidence of heart disease in men who have generally higher testosterone levels, also less prostate cancer in men who have higher testosterone levels. Growth hormone. Growth hormone is interesting. Now, so far, we have discussed hormones that are made by various organs, stimulated by the pituitary gland in the brain. Growth hormone, however, is made directly by the pituitary gland and goes straight out to many, many tissues in the body. It's been studied at length. There are many, many studies of growth hormone, and it's been shown to enhance cellular immunity. There's one way of referring to the thymus gland is as central immunity, as well as affecting the immune function out in the various areas of the body. It actually increases the production of B lymph cells. These are particular types of white blood cells. And it also promotes antibody production. It's been shown in burn patients to actually reduce infection. Of course, that's one of the biggest risks to people that have had extensive areas of burns on their bodies is infection. And growth hormone has been directly shown to reduce the incidence of infection, even in these very injured people. And we're talking about physiologic doses of growth hormone. Growth hormone always gets a bad reputation because of athletes who abuse it, and they're using it in 100 times appropriate dosing. However, in physiologic dosing, it's reasonable both in terms of cost and also in terms of impact, and can be extremely beneficial. Cortisol is necessary to life. This is a hormone that we cannot live without. It is made by the adrenal glands. And again, we are looking at physiologic doses being supportive of immune function, whereas too much can actually suppress immune function. Typically, when the adrenal glands are stressed, initially they will overproduce cortisol, and that can be some short-term effects of stress. However, in the long run, there can be adrenal fatigue or adrenal insufficiency and even adrenal failure. And then there can be too little cortisol, and replacing cortisol can actually be very beneficial. It, again, increases antibody production, and at physiologic levels can actually fight off infections with various viruses and bacteria. DHEA is another hormone that is produced by the adrenal glands, and this one is not necessary for life. This is in the area that is often referred to as anti-aging medicine, and that is because, as you can see here, in addition to stimulating the immune system, DHEA actually reverses some of the decline in immune function that occurs with age. Let's see. It stimulates antibody production and, in other words, antibody response to offending, invading organisms. It does decline with age, and therefore we see the onset of illness generally being greater as people get older. It also slows down autoantibody production. So when people inappropriately make antibodies against their own tissues, DHEA actually decreases this response. This is all in addition to the benefits in terms of how people feel. I'm focusing on immune function this evening, but all of these hormones are very beneficial in terms of helping people feel their best. Thyroid hormones are the subject of many talks that Dr. Holtorf has given. Several of them are actually posted on the holtorfmed.com website. I always recommend that people spend time on that website. It's just chock full of all sorts of information, articles and studies, lectures by Dr. Holtorf, several of the webinars he's done. And thyroid hormones really affect all levels of the immune system. As we know, thyroid hormones cause our body temperature to be optimal. And that's one of the most simple ways to assess thyroid function is core body temperature. And when our bodies are at lower than proper temperature, we don't fight off infection efficiently. That's one of the functions of actually having a fever, is to ramp up the body's immune function and begin to fight off the offending organism. There's also various ratios among subsets of white blood cells, and thyroid hormone levels are essential to the proper ratios among the white blood cells as they're being produced. So again, this is the topic of several hours of discussion, and I'm just giving it a brief mention as part of this overview. Melatonin. Melatonin promotes healthy sleep. It is secreted by the brain while we sleep, so we want to do everything possible to protect our sleep. It actually has direct effects on the bone marrow, on the immune system. The thymus gland is an area in the middle of your chest that is very large when we are born and decreases in size over the course of our lifetime, and oftentimes will completely disappear in some people. However, melatonin, which again we secrete while we're sleeping, keeps that thymus gland active, and which is very important to the immune system. Melatonin supplementation is most effective at night. That is when the receptors are activated and the whole system is in play. Melatonin itself also has antioxidant properties. It's been studied in cancer patients after their treatment and been found to be very helpful in that setting as well. Okay, I'm going to turn our attention a little bit now to a study called the Women's Health Initiative Study. So I'm switching gears here a little bit, and again, in honor of Breast Cancer Awareness Month, begin to spend a little bit more time focusing on hormone balancing as it relates to breast cancer in particular. The Women's Health Initiative Study was a study that was initially starting to produce published results in 2002. So a little over 10 years ago, the first findings were published, and it got a lot of attention at that time. So this is a large study that was performed in the United States, and it was considered to be a gold standard format of the study, which is a randomized, controlled, placebo-controlled, double-blinded study. This means that neither the doctors or the women in the study knew which arm of the study they were in. And the women, on average, were in their 60s. That was about the average age of the participants. And this was necessary because otherwise the women in the placebo arm of the study, who were not being given hormone therapy, if they had been younger and having menopausal symptoms, they would have realized what arm of the study they were in. If they were being given hormones, their symptoms would get better, and if they were being given placebo, their symptoms would not get better. So therefore, to do the study, they had to use women who are on average in their mid-60s well into menopause. So that's why the first bullet point on this slide says the wrong women. So when we look at this study, and we're going to look at some of the findings in a moment, we see that, and subsequent studies have actually confirmed this, that when you start the hormone balancing, when things first start to go out of balance, you will actually see a great number of benefits that were not demonstrated in this study because really they were looking not at the group of women who could best benefit from the estrogen and progesterone. Which brings us to the second bullet point, which is the wrong hormones were used. Now, of course, the makers of Premarin and Provera were purposely using their hormones. They were hoping to follow up on many studies that had shown a decrease in cardiovascular events in women who were taking estrogen. So the makers of Premarin and Provera were motivated to perform this study. And what we have realized in the aftermath of the study, so when the study first started publishing findings in 2002, what actually happened at that time is that one arm of the study was stopped. So there were two arms of the study. One arm had women who were on Premarin and Provera. Premarin is an oral estrogen. It is made from horse urine, distilled from that, and taken orally as a tablet. And the Provera is a synthetic progestin. It is not similar to natural progesterone, and was shown at that time, the women in the estrogen and progestin arm, that arm of the study was stopped because they found a trend towards an increased incidence of breast cancer in those women. What multiple large studies have shown since then is that it is actually the progestin that increases the risk of breast cancer. Now, we're going to look at things a little bit more detail in a moment, and I'm going to allow plenty of time for questions as well. But that's what I mean when I say wrong hormones. So it was the particular progestin used that actually was increasing the risk of breast cancer. And we'll see that because in a moment I'm going to show you the estrogen-only arm of the study, which actually had women only on estrogen. It was felt that they did not need a progestin because they had had hysterectomies, so therefore they did not need the lining of the uterus balanced with the progestin. And in that arm of the study, we will find that a couple of years later, they were found to actually have a lower incidence of breast cancer. So we'll talk about that. And the third point, I just want to do a brief mention here, the wrong route of administration. So in terms of the benefits of estrogen, there are, in terms of immune function, there are benefits to estrogen no matter how it is administered. However, the women in the WHI study had a higher incidence of cardiovascular events because they were taking the estrogen orally. So that's the comment here. But I'm going to bring us back to the topic of cancer now. A very important concept, and we talked about this in a webinar that I did in July called Why Women Shouldn't Be Afraid of Hormones, and that one is posted on the holtorfmed.com site. And what we're looking at here is a very important concept of absolute risk versus relative risk. And what we're looking at here is actually a piece of informational material put out by the makers of Premarin and Provera. And what this showed was that the actual numbers of increased cases of breast cancer were extremely small. So if you're in front of your computer and you can see the area where the women who were taking estrogen, the Premarin and the Provera, there were an additional 4.1 cases out of every 1,000 women. And in the women taking placebos, there were 3.3 additional cases. So if we multiply this to get whole people, and we say out of 10,000 women, there were 8 additional cases of breast cancer. So it's very important to keep in mind absolute risk versus relative risk. The relative risk was considered a high enough increase that this arm of the study was stopped. But in terms of women who aren't feeling well, it's important to know that the absolute numbers were extremely small. So here we have information on the other arm of the study, and this is what I wanted to focus on more for our purposes tonight, and that is that if we look on the second line, I'm not sure if you can see my cursor, but I'm pointing to the second line of the table that shows breast cancer. And again, if we multiply to get whole numbers, we see that there were 6 less cases, fewer cases of breast cancer in women taking estrogen compared to women taking the placebo. You'll also see quite a few things that were lower in incidence. For example, hip fracture, vertebral fracture, colon cancer, the vertebral fracture, hip fracture are lower, and so I want to just make a mention of that because another finding from the study was that women who were on the hormones, whether they were on just estrogen or estrogen and progestin, had lower mortality from all causes. So even in the women who had the colon, the additional one woman who had colon cancer in this arm of the study, and the additional women having the cardiovascular events, the blood clots, heart attack, stroke, these were additional events of these because of oral estrogen, that there was still lower mortality across the board in the women taking hormones compared to the women taking placebo. So I like to use this information to really reassure women regarding the risks. It gets a little technical in terms of interpreting the data. However, it's simply the more we look at the data, the more we see that estrogen and particularly bioidentical forms of progesterone not only do not increase the risk of cancer, they actually lower the risk of breast cancer. So again, we were just commenting on the Women's Health Initiative, which is still, there are still studies being published based on the findings from that study. They're just milking it for all it's worth. And there are many of us who are ready for them to please let it go, but a lot of money was invested in the study and they're getting as much published material out of it as possible. The second bullet point on this slide actually is summarized in this. Now, I rarely have slides with so much detail in my presentations, and actually, I think I'm gonna see what we can do about getting this posted somehow on its own, maybe as a PDF that can go up. I'll discuss that. We'll see what Dr. Holtorf says about that. But this is a summary based on a PubMed search that was done a while ago, and it showed quite a few studies. At the time were recent studies. There are other studies since then. However, what's significant here, excuse me, is that these are studies of women who actually had breast cancer and for various reasons were given various forms of hormone therapy afterwards. Most likely these included women who were younger when they went through their breast cancer, and they were very symptomatic and needed hormone therapy in order to be able to function. And fortunately, there were people who collected this data, and they found all sorts of excellent outcomes, which is this last column that we're looking at here. So these outcomes ranged from that there was no worse outcome, there was no worsening of survival after breast cancer, all the way to benefits to survival after breast cancer, less recurrence of breast cancer. Also a study that was shown to demonstrate that hormones did not impair the detection of breast cancer. That's always one of the concerns. And I will never forget one of my first job out of my residency about 18 years ago, where I had a patient in her, I think she was about 52 years old. She had had breast cancer. She had been on hormone therapy, but she was taken off of her hormone therapy, and she was almost non-functional. She was an attorney, and she basically could barely get through her day. And this was, of course, well before these study findings were published, but at that time it was really considered that estrogen would definitely be harmful for a breast cancer survivor. However, I was able to, after getting yelled at by her oncologist, we were able to all work together and really have her have a quality of life. And then, of course, since then, the data has come out with many, many studies showing that, in fact, it's not detrimental and possibly actually beneficial. That's what these studies show on this chart here. So really what we're interested in is a balance in life. And this is my last slide. I wanted to leave plenty of time for questions. And that's what we're aiming for, is that balanced hormones, both specifics and also in general, because these hormone levels actually interact and influence each other. And so it's all part of the symphony that our bodies are. And we are really here to help people have not just sufficient hormone levels, but really optimal hormone levels and balance to have excellent immune function and excellent health. So I appreciate everybody being with us tonight. And Jenny, let's take some questions.
Great. I've got just a few, and then we'll get Dr. Holtorf on the line to visit with you as well.
Great.
Dr. Liz, my wife has been taking cortisone injections in her back for about 5 years, about 2 to 3 a year. She's now on estrogen and progesterone currently, and she doesn't have any sex drive. Is it possible that she has little or no testosterone?
Absolutely. It's likely. Testosterone and DHEA. DHEA is a major source of sex drive for women. Again, as I said, made by the adrenal glands. The testosterone is also made by the adrenal glands primarily at this point. And luckily, they're easy lab tests to check. The cortisone injections are potentially influencing what's happening as well. However, definitely an easy place to start is checking testosterone and DHEA.
Great, thank you, Dr. Liz. That's all the questions that we have popping up right at this moment, so I thought I'd let Dr. Holtorf go over anything with you. No? Okay.
Yeah, I think it was a great presentation and about a very controversial area, and it's interesting as you were saying, all the oncologists, especially, it's like, well, they look at the literature. No, they just keep repeating what they were taught in medical school. And when you look at the studies, are very reassuring, especially when you start talking bioidentical versus synthetic. So it's interesting how you think a specialist would be interested. But I've had so many patients, they've gotten breast cancer, let's say they're 3-4 years out, and they are miserable. They can't sleep. And I'll send over studies to their oncologist, and not once have they ever they just hand them back to the patient, no, I don't need to read these. And the patient, is totally motivated. Look at all these studies showing that it prevents, especially with estriol and progesterone. But, it's one of those things they rather not know. So great information, Liz, and thank you so much.
Thank you. Thank you for mentioning estriol. Let's say another word about that. I want to have that as part of the recording. Estrogen comes in various forms. There's the most potent form is estradiol, which is all the pharmaceutical estrogen products generally are only estradiol. Estriol, however, is the main form during pregnancy, and it's a weak form, and it's been shown to be protective. Yes, protective of breast tissue. I'm aware of animal studies. Are you aware of human studies as well, Dr. Holtorf?
And what's interesting, there's not a lot of great double-blind placebo-controlled studies, but there's a lot of very large studies done in Europe. And Wyatt actually was trying to promote for a while estriol as being the new form of hormone replacement. And then when you look at the physiology, so there's two estrogen receptors. There's estrogen receptor alpha and beta. Now, alpha stimulates breast tissue, and beta basically blocks that, so it's cancer preventive. Estradiol it has both, about 50-50, so it's pretty neutral. Estrone is actually an estrogen receptor alpha dominant, so it will tend to stimulate breast tissue more. That's kind of the menopausal estrogen. And then estriol is a selective estrogen receptor beta, so it prevents cancer, prevents the cells from multiplying. And so it's basically, that's why we like to add it to estradiol, and so you're getting really a cancer-preventive estrogen rather than a potentially cancer-causing, which everyone associates with estrogen.
Absolutely. And so when we do custom compounded formulations for patients, it has estradiol and estriol so that patients get the benefits from the potent form and the protection from the weaker estriol form.
And there's not a lot
of great studies. And then also estriol has a higher affinity for vaginal tissue. So for women who have a real concern and aren't comfortable with systemic estrogen, they can at least use vaginal estriol to treat the vaginal and base of the bladder tissues. I've seen that as well in many women. After breast cancer, they go off their hormones and then start having urinary tract infections and have a real problem with that. So,
right, and the OB just says, well, just live with it, And there's no great study for what's the best ratio of estriol to estradiol to use. And again, a lot of doctors will use Triest, which has estrone, but there's really no reason to do that. You're giving a bad estrogen. But, you look at a lot of doctors will use an 80-20, so 80% estriol, 20% estradiol. The problem with that, because the estriol will work as a agonist-antagonist, meaning that it will kind of block the effects, you need a lot more. So people will come in and go, bioidenticals don't work for me. And because they've been taking too much estriol and they don't have enough effect. So we see a lot of patients with that, and the doctor won't know much, and they'll put them on it, and they'll say, see, it doesn't work. Because they just go, off of what they've heard what is the formula. So we find a lot of patients, think that they don't work because a lot of times it's just too much estriol. But we like some there to help, to prevent the breast cancer, as well as progesterone is wonderful. If you want to cause breast cancer, take a progestin. If you want to prevent breast cancer, take progesterone.
Yes. Shown in several large studies, including studies in Europe, which our FDA doesn't use that data.
Correct, and they're very large studies, too.
Right. Yes. Great. I think that's really what we wanted to cover. I think this will be good information to be able to carry forward and possibly do a Facebook chat in the future. And so thank you very much, Dr. Holtorf. And thank you, Jenny.
Thank you, and we'll have this posted on the website probably tomorrow afternoon for any of you that are listening that didn't get to listen to the entire presentation, or if you know of anybody else that might want to be able to view it, we will have it available tomorrow.
Fantastic.
Thank you, Dr. Liz, and have a great evening, everybody.
Great, thank you.
Thank you.
Okay. Have a good night.